Hey everyone, Mike Rydell here. You're about to hear a really meaningful conversation that we had with Jeff Winton of Rural Minds. We talk about mental health in rural America and why it hits ag communities a little differently. We're going to give you a bunch of practical tips about ways to start better conversations and connect real people with real resources. If you work in agriculture or care about someone who does, this episode is for you. Welcome to the Crop Insurance Podcast. I'm Mike Rydell, a third-generation crop insurance agent here to make federal crop insurance less confusing and more useful. Whether you're a seasoned grower or just getting started, we're here to help you stay covered and confident in every season. Today's episode is brought to you by the Crop West Insurance Group, your agent-friendly crop insurance group. If you want more support, smarter marketing, and better tools to help grow your agency, Crop West's expert team has your back. Visit cropwestinsurance.com to level up today. Crop West Insurance is an equal opportunity provider and employer. Well, welcome to the Crop Insurance Podcast. I'm your host, Mike Rydell, and today I'm very excited. We have a special guest, Jeff Winton of Rural Minds. And just real briefly, I'm going to let Jeff introduce himself, a little bit about his story, but I just kind of wanted to touch on how this came about and how I met Jeff and kind of, the purpose of this podcast for the listeners out there is, as a lot of the people that listen to this podcast are crop insurance agents, federal employees, crop insurance company employees, crop adjusters, people that work in agriculture. Yes, we do have quite a bit of farmers that listen as well, but a lot of these agents and other people that deal in the agricultural industry have reached out to me wanting resources on mental health, is not only for themselves, but they're finding that a lot of the people they're working with are in a different spot than they've been in before. At least it just seems like there's, I don't want to say an epidemic, but there's certainly just a lot more mental health concerns that are prevalent today than it seems so more so than in the past. And a lot of these people have reached out and said, hey, we want some resources. What do you think? What are you doing as a crop insurance agent? What resources are you getting from the federal government or from the insurance companies? And the answer is, well, none. We haven't got any resources, any education or anything like that. And you can always go on ChatGPT and, wing it with AI, but I think something as important as mental health requires a human touch. And that's why we've kind of gone out to find some of these people. And with Jeff, I happened to be at Montana Grain Growers Association convention in December. And I'm friends with some of the board members and the president. So thank you to Steve Sheffels and Boyd Heilig. I just mentioned to them as Jeff was speaking, I'm like, I would love to meet Jeff and see if he'd come on the podcast. Well, they reached out and told Jeff this, and by the end of the day, Jeff stopped by the booth, introduced himself, and was so opening and welcome to want to come out and speak on our podcast. And just kind of that says what kind of guy he is in spreading this message. And it's just, I couldn't be more grateful and thankful to have you on here. So I'll kind of be quiet now and let you introduce yourself and tell us a little bit about Rural Minds and your story.
Yeah, absolutely. Well, thank you very much, Mike, for the invitation. It's a pleasure and an honor for us to be on your show today. My name is Jeff Winton, as Mike said. I am a dairy farmer in upstate New York. Our farm is located on Lake Erie, not terribly far from the Canadian border. As a matter of fact, we're expecting one of our usual lake effect snowstorms any moment. And as you folks can imagine, life on a dairy farm is difficult enough, but especially when you get several feet of snow at a time, it can be very trying. So we are, bracing for that, but it goes with the territory when you live where we live. I'm from a long line of dairy farmers. My father was a dairy farmer. My grandfather was a dairy farmer. My great grandfather was a dairy farmer. We've been dairy farmers for as long as we can trace the family tree back. So this is something that's in our blood, it's in our DNA, and something that, despite the challenges we're facing right now, because the price of milk is very, very low, and of course our price of inputs is very, very high, like crop farmers is. We're struggling along with the crop farmers. But in any case, I am going to be telling you a bit of a family story, if I may, that is the reason that I'm here talking to Mike today on this podcast. I want to take you back to the year 2012, specifically September 1st, 2012. It was a beautiful September fall day here in Western New York. We're in the rolling hills, the Allegheny Mountains, and get some beautiful, beautiful falls because of the maple trees and a lot of the other vegetation here. So it was a picture perfect day, and it was a very important day in the life of my family because my oldest nephew was getting married, the first in that generation. And so the family had all gathered. The wedding was at a small country church here in our small town of 500 where I was raised. And then the wedding reception was at a rodeo grounds, which in this area is where most farm families have their wedding receptions because, quite honestly, we can't afford to have them at big fancy catering halls. So we were at the Gary Rodeo Grounds. And after a really fun time of celebrating my oldest nephew and his new wife, I was getting ready to leave the reception, and his younger brother, Brooks, came up to me with his 3-year-old twins, one in each hand, and gave me a big bear hug and said, "Uncle Jeff, I just want to thank you for everything you've done. I really appreciate what you've done for me and the twins and my family." And I didn't think anything of it, quite honestly, because my nephew was a very grateful, very thankful young man who always went out of his way to show his appreciation and his gratitude. And he also worked here on our farm. And because of some of the issues his parents had, my parents, his grandparents, helped raise him and his siblings, including his brother who had just been married. So, in a lot of ways, he was more like a brother to me than a nephew, but just a great, great guy. So that was September 1st. September 2nd, fairly unremarkable day on a dairy farm. We got up at 5 in the morning. At that point, we had 3 different farms in the area. So I was going farm to farm to make sure everything was getting done in order. And as I was driving back around the lake where we live, I happened to be passing my nephew Brooks's house where he lived with his twins and his fiance. And as I approached the house, I saw red lights, I heard sirens, I saw a fire truck, I saw an ambulance, I saw police cars, and obviously I knew something had happened at his house. So I pull my pickup truck into the driveway. The woman across the road that I'd grown up with, because again, it was a small town and everybody knows everybody, came running across the street with tears streaming down her eyes and grabbed me and gave me a big hug and said, "Jeff, don't go any further. I just found Brooks in the backyard of his house and I think he's dead." Like, now what do you mean you think he's dead? I just saw him at his brother's wedding 2 days ago. I just spoke to him yesterday and we were supposed to get together today. I said, this got to be a mistake. This can't be real. It can't be happening. Well, sure enough, a few minutes later, the coroner shows up and my nephew was dead. And eventually it was ruled it was death by suicide. And as you can imagine, at that point, my family's life was changed forever. The world stopped. Things that we used to take for granted will never happen again. And we were in a new reality, a reality that none of us ever expected we were going to be in, especially after just having celebrated the wedding of his brother. So we went to meet with the pastor to start planning a funeral for a 28-year-old farmer, father of 3-year-old twins, who appeared to have everything going for him. He loved his twins. He was a very devoted dad. He loved his fiancee. They were looking forward to the wedding. He was buying his first home. He had everything imaginable, it appeared, to be going for him, except we learned he had been suffering in silence with mental illness. And the only reason we knew what he was dealing with is because he left a note in the pocket of his jeans for when his 3-year-old twins were old enough to try to understand why their daddy felt that he needed to leave this world. That's all we knew because there were no signs whatsoever. He was a very outgoing guy, very gregarious, bigger than life, including physically bigger than life. He was a star football player and star wrestler, if they could find a wrestler big enough for him in this area to wrestle. And had so many friends from all walks of life. My nephew knew no strangers, but deep down he was hurting and hurting so badly he decided he had to leave those twins and his fiancee that he loved more than life. So as we're meeting with the pastor in the study of our small town church, the pastor looked at my mom, who basically had helped raise my nephew, and said, "Mrs. Winton, what do you want to do?" It became apparent, the reason he asked that question is that there were certain people in the community who didn't feel we should talk about the fact that my nephew died by suicide. They actually thought that either we shouldn't talk about it at all, or we should even go as far as make up an excuse. Say he died in a farming accident, or say he died of a heart attack. And my mom, who was a very gentle, very quiet, very kind woman who worked on our farm, with tears running down her face, said, "Pastor, this is going to stop with my family. This has been going on much too long in this farming community. We know other families have faced this, but no one else has been willing to talk about it. We are going to start talking about it, and we're going to start talking about it at Brooks's funeral." So 2 days later, we all gather again for the funeral of this young man, hundreds of people, standing room only in this small church, because my family has been here forever. We're very well known in the area and farming communities especially. And my nephew had so many friends, and being a young person, we had a lot of his friends he had grown up with here who, as you can imagine, were devastated. And so I was asked to give the eulogy, which I must say was one of the most difficult things I've ever had to do. But I held it together until the very end, and then I lost it, but at least I got through most of it. And we went into as much detail as we knew about what he had been going through, basically based on that note that he had left in the pocket of his jeans he was wearing that night when he died. And after we were over, and after everything was said and done, we had other farm families lined up for hours to tell us their stories, stories that they hadn't ever told anyone because they were too ashamed, they were too embarrassed. They didn't feel that anyone would understand why one of their family members would die by suicide. So either they hadn't talked about it, or they talked about it in such broad detail that no one could determine what the person that they had lost had died from. And at that moment, a seed was planted for this movement that now is called Rural Minds. We are the only national 501c3 nonprofit organization in America that is focused on rural mental health equity. So there are a lot of other mental health organizations, many of whom we partner with, that are focused more on urban and suburban people. But when my nephew died, we started reaching out for support, for help, for resources as we grieved to these other groups. And basically, the question we asked was, what are you doing for farm families? What are you doing for the 46 million people who live in rural America? And every single question was met with a respectful pause and then the admission that they weren't really doing a lot because they didn't know us. They didn't know how to reach us. They didn't know how to talk to us. And it was with the encouragement of these other groups that Rural Minds was founded. Now, again, I told you the story that started in 2012. And again, we just launched 4 years ago in 2022. And you might ask, well, why did you wait so long? The reason we waited so long was because of those 3-year-old twins. The family felt like we needed to give them as much of a normal childhood as possible and let them grow up. And once they became teenagers, not only tell them the full story, but then get them involved in the work. The kids just turned 16. We just celebrated their birthday at their favorite hibachi restaurant here in our rural area. We had a great time. They're wonderful kids. They obviously miss their dad tremendously, but they now know what happened, which is so important, Mike, because many people don't realize that just like cancer, just like heart disease, just like diabetes, mental illness has a genetic predisposition. It runs in families, just like physical illnesses do. It runs in my family, but guess what? We never talked about it until my nephew died. And once Brooks died, all of a sudden we started realizing, you know what? We've been covering this up too. And it took the suicide of our loved one to get us to admit what was wrong. So it was important that his children know because we want them to be vigilant that this could be in their genetic makeup. And there's nothing wrong with them coming to us asking for help, which quite honestly, I've had some heart to heart conversations with both of them, but they're sensitized now and they know that this is something that they're going to have to monitor. As are other members of my family now realizing that this is an illness that we shouldn't be ashamed of. But, you know, people in rural America, especially on farms, from the time we're young kids, we're taught to not talk about our problems. We're taught to pull ourselves up by our bootstraps. We're taught to be independent and just get over whatever's bothering us. And you know what? This is an illness just like cancer. You can't just snap your fingers and get over prostate cancer or breast cancer. You can't just snap your fingers and get over some kind of a cardiac issue. You shouldn't ever feel like you should be snapping your fingers getting over depression, PTSD, substance use disorder, because it's an illness very much like those other physical illnesses. So that's just a little about who we are. I'm happy to go into more detail about programs we're doing and things of that nature. And I know you have some questions too, Mike. So I've done a monologue up until this point. So I'm going to stop and catch my breath and let you jump in and ask me anything you'd like me to talk about.
Yeah, no, thank you so much for sharing. And I guess, first of all, so sorry for your loss to you and your family. It's commendable what you're doing. Lots of times tragedy can happen like that and people just continue to ask why. And it sounds like you guys are kind of taking the stance of kind of the never again situation. And it's commendable. So thank you so much for sharing. I'm sure you've told the story many, many times as your organization continues to grow, but I cannot imagine that it gets any easier. So thank you.
It doesn't.
Very much appreciate that.
On one hand, it's therapeutic each time I tell it, but on the other hand, the Band-Aid gets ripped off each time I tell it. And I rarely get through it without getting choked up, and I did this time as well. So it's
Yeah,
just human nature.
and I can't. I mean, I can't imagine, and I don't blame you. And I think there's so many things you said that I come from a rural part of the country in Montana. A lot of the people I work with are rural farmers. So this is the target audience to this program. And I think not only in previous generations has, you just mentioned it and you said it in your video, how we're taught at a young age to be independent, pull yourself up by your bootstraps, be self-sufficient, and not talk about your issues, right? Be a man, you'll be okay. And that's true all over, but I find that really in rural settings, in farming and ranching, it's even more true as
Yeah,
you're the primary breadwinner or source of income, and you need to worry about the crops, the cattle, your cows, all these other things, and not worry about yourself.
yeah,
And
that's
so
right.
I think these programs like you have, and we'll go into them a little bit here in a little bit, is just shining a light that I've heard it. Last week, I interviewed Dr. Arzubi. He's a
Oh, yeah,
psychiatrist in Montana, and I've heard this saying before, but he mentioned it as well as it's okay to not be okay.
yeah, yep.
And I think that people forget that. And so with rural minds, and we can understand from your story the problem you're trying to solve, but how has it been received as you go into these different rural communities, and not just the one that was directly impacted, but as you go into these other rural communities, what kind of reception are you getting with your programs?
Well, the reception has been remarkable, quite honestly. We weren't sure until we started what we were going to find. We thought there was a possibility that people were just going to shut down and not want to talk about it. But the exact opposite has happened. We have people telling us stories many times, just like at my nephew's funeral, for the first time they've ever told anyone. The meeting where we met, literally probably 10 minutes after I met you, Mike, at your booth at the Montana Grain Growers, I was out in the lobby, kind of mingling, talking to people, and I had one of the attendees come up to me, introduced himself, and we kind of stepped off to the side because I could tell he wanted to tell me something. And he told me a heartbreaking story about how he had been at the end of his rope and didn't see any way out and had decided that he was going to end his life by shooting himself. And the day rolled around when he decided he was going to do this. He had a revolver to the temple of his head. And about the time he was getting ready to pull the trigger, his cell phone rang and he looked over, and it was a friend of his from 25 years ago that he hadn't heard from. And he said at that point, he dropped the gun, he grabbed the phone, and he realized that this wasn't a coincidence. This was divine intervention. That this friend, out of the blue, after 25 years, called him as he was ready to end his life. And that story, as remarkable as it sounds, I hear those constantly, no matter if I'm in Montana, the state of Maine, Alabama, California, here in upstate New York. Again, we're a national organization and doing some work now internationally as well, because obviously most countries have rural areas. They're facing many of the same things we are, but nobody had really been doing much for the tulip farmers in the Netherlands, for example, until we came along. So, even though the type of agriculture varies from area to area, the stories are the same. The stories of despair, the stories of shame, the stories of not knowing what to do, the stories of loss. But the key is getting people to talk. It's all about storytelling. And Mike, you can appreciate this. That's what you do as a podcaster. It's storytelling. And that's why I always start no matter if it's a media interview or a talk like I gave at the Montana Grain Growers, I always start with the story of my nephew because we're trying to humanize something that has been hidden much too long. We're trying to put a personal face on this. And our feeling is by being vulnerable ourselves, that other people will feel, well, you know what, if that guy is willing to stand up on the stage and tell the story in front of several hundred people, I'm going to talk to my pastor. I'm going to talk to my wife. I'm going to talk to my school counselor in the case of a young person. So the bottom line is as simplistic as it sounds. We're trying to get people to talk. We're trying to get people to admit they have an issue and to at least reach out to one person. And many times that one person may be me. It may be somebody else within Rural Minds. People will reach out to us, and I'll make sure, I share my contact information before we finish today. But if people don't feel that they have anyone else they can reach out to in their family or community, we want to be that person. We want to be that resource that they will tap into. And, we're also trying to tackle the stigma that exists. And mental illness has always been highly stigmatized, even in urban and suburban areas. But people that live in cities and the suburbs tend to talk about it a lot more than we do. That's one of the reasons that some of the latest statistics that I've read are shocking. People in rural America are 50% more likely to die by suicide. But what's even more tragic is young people that grow up in small towns like where you grew up in Montana, where I grew up here in upstate New York. Young people are 74% more likely to die by suicide than their peers in cities and suburbs. That's tragic, and that's something that's got to be addressed. Farmers in particular are 3.5 times more likely to die by suicide. And on it goes. So we're in a race against time, and that's why we're doing as much as we can as a very small young organization to get the word out that there is help. But in order to get the help you need and you deserve, you've got to admit you've got an issue, and you've got to not be ashamed of it. But, in small towns like where I live and probably where you grew up, Mike, everybody knows everybody. Everybody knows everybody's business. Everybody knows everybody's pickup truck. And I've had farmers say, even if there was a mental health clinic in my community, I'm not going to have my Ford 350 parked out in front of it because everybody knows that's my truck. And the word's going to start spreading through our small farming town that Farmer Brown's having some kind of a mental issue. So that's why we're really trying to tackle the stigma by storytelling and making sure that people realize that this is an illness. This is something that is part of the human condition, that you didn't decide one day you were going to have depression when you woke up. A lot of it is episodic because of what's happening in the farming community and what's happening in agriculture in general. And within the last year, the number of calls we're getting has skyrocketed as trade wars have taken place, as the tariffs have been put in place, as immigration has basically decimated a lot of the farm workers. Healthcare, rural hospitals are closing. We're going to see Medicaid cuts. We're going to see a lot of things that are impacting healthcare in rural America, which is already stretched, if not non-existent. And, I was telling you before the podcast started, I can't even get in to see my primary care physician because he's so overwhelmed. He's canceled my appointment twice. So, if that's happening with primary care physicians, you can only imagine what's happening with mental health providers. And, the fact remains 65% of the counties that are considered rural in America have no psychiatrists. There may be little, if no, mental health help in that county. So that's why when you had Dr. Arzubi on, who's one of our partners, by the way, I don't know if you knew that, but we work with him up in Montana. He's doing so much in the space of virtual help and using broadband services and telehealth. And while it's still not the panacea, it is for urban and rural areas because, again, nearly 30% of families in rural America have no broadband because it's not available, including here where I live. I have it, but it's the last house on my country road where they were willing to put it because they said there's no return on investment to put it any further down the road. So, but it is helping, and certainly in Montana, where it's even worse than in upstate New York, where you have to drive sometimes hours to get to a healthcare facility that can help you. What Dr. Arzubi is doing up there is revolutionary, and he was doing it way before COVID, as I'm sure he told you on his show last week. So I want to hear that podcast. Make sure you send that to me.
Oh, absolutely. Yeah, no, there's a lot to unpack there. And I think that starting with Dr. Arzubi and what he's talking about with telehealth, I think a lot of people are not quite sure about telehealth. And like he says, is if it's a difference between telehealth and no health care,
Right.
telehealth is the way to go. And I think people in the urban environment that may be listening are used to telehealth for like basic care to get a prescription for an infection or something of that nature. That's already commonplace. But like you had mentioned, then you go to the rural side of things, and high speed gigabit internet is not a given like it is in
Yeah.
the urban environment. And even cell signals, people don't understand. It's always the joke when the phone calls still get dropped in Montana when we're out visiting the farms. And my dad always used to just joke, a pigeon flew by, so cell coverage went out. And that's just how it is. There's not cell coverage, there's not internet. So it makes these barriers to entries harder, but not impossible. And I think one of the things you touched on initially and you continue to touch on is when people such as yourself share your story and other people you meet then share their stories, and it kind of creates a snowball effect of what I would call courage and being courageous and sharing your story, because it is okay to not be okay and understand that everybody out there goes through some sort of mental health crisis
Yeah.
at one point in their life or another. Some may be, it's a spectrum, maybe minor, some may be major, but everybody's going through something. And by sharing your stories and reaching out to these people, and what Rural Minds is doing, focusing on some of the more vulnerable in rural America is commendable. I know I have a very good friend who's a rancher, and he leaves the ranch maybe 2, 3 times a year. So
Yeah.
doesn't get that human interaction that people in the cities, even a small city like Great Falls, Montana, 50,000, that's not rural compared to the people that I service who graduated with a class of 10. Where K through 12 is maybe 50 kids.
Yeah.
That is where a very underserved community, but yet one of the most important communities in America, as we get our food and fiber from there, matter of national security, and they're getting left behind. And so things that Dr. Arzubi are doing, that you are doing, are just fantastic. And I just can't, it's just awesome to hear you speak about it, and your passion comes through. And I hope people listening will then take that and help reach out just to check on their friends and see if people are okay.
And that's key is we all need to be vigilant and we all need to be aware of what's going on with the people that live around us and people in our families. And don't be afraid to ask difficult questions. One of the most difficult questions that I've been trained about to ask someone that's struggling. And the first time you ask it, the words get stuck in your throat. But that question is, are you thinking of harming yourself? Are you thinking of killing yourself? And, the old school of thought would be, well, my goodness, if you ask somebody that, you're going to plant the seed. And of course, they're going to consider it. But research has shown over and over again, as Dr. Arzubi would point out, that that's not the case. It has the exact opposite effect, is that it makes people realize that someone cares, that someone's paying attention to them, that someone cares enough to ask them, are you thinking of killing yourself? So we all have to be aware of our surroundings, especially in farming communities. Many times there are telltale signs that a farmer is struggling. And I use this example often, but a farm that's normally very well kept, that the buildings are painted and the equipment is kept clean and put away in the sheds and everything looks like it's in order. If all of a sudden that farm starts to look like it's in disrepair and things are starting to not look nearly like they used to, something is going on. And it could very well be that the person operating that farm is struggling to the point where they can't take care of it anymore. They don't care anymore. And so, as well as, you go to church and, the farmer that used to sit two pews in front of you hasn't been there for several weeks. You need to give him a call or swing by his farm and say, hey, we've missed you. Is there a reason you haven't been coming by? And just showing that you care and just showing empathy. And I mean, that's what life in small town America is all about. We've got each other's back. We are there to help support each other. And that needs to include people that are struggling with mental illness and substance use disorder. And that's why a lot of our programming is geared towards being implemented where people in rural America are already going for trusted information. So when we started doing the research and the planning for Rural Minds, we knew that people in rural America weren't likely to drive to the nearest city to sit around a table and pour their heart out. That's just not how we're wired. And plus, even if they are wired that way, they don't have time to do it. They're running a farm, they're a veterinarian, they're, a crop person. So we decided that we needed to find where people in rural America were already going, where they've been going, where they go to meet with their neighbors and people they trust and people that they respect. And that happens to be the wheat growers, that happens to be grain growers, that happens to be the American Soybean Association, happens to be the Farm Bureau, the 4-H, FFA, on and on and on it goes. And, in rural America, there are a lot of organizations like the National Grange, which is one of our biggest and most important partner that's been around for 170 years. They're in 1,500 locations across the country in rural areas. And so generations of families have been going there. And so we are now working with them. I was on a call with them last night with 100 people from all over the country about a program I know we're going to be talking about here in a minute, that they helped us develop that's being utilized by the National Grange and many other people. Communities of faith play a role here, getting this programming into the schools, into the rural schools, into first responders, volunteer fire departments, places of that nature. So that was our goal, and that's what we've really been focused on, is creating programming that can be utilized at a grassroots community level.
Wow, that's fantastic news, and it's exciting. It's exciting to get all these resources out. Now, I know if you're listening to this podcast, you definitely want to go over to our YouTube page, as we're going to do a screen share here in a second to kind of walk you through. But, I've been taking notes on all of these different talking points that Jeff has made and these different resources that he's mentioned. And I know that can get cumbersome, but So if you go over to his site now, Jeff had mentioned they're redoing their
Yep.
website that'll be coming out soon. And right now we're just looking at ruralminds.org. So ruralminds.org. And once you go onto this site, we won't go through the main site because, like you said, they're getting a new one. But if I were you and you're just listening to this, go to ruralminds.org, click on the watch the video. It's a link on the right-hand side. It's a nice 6-7 minute video where he tells the story. Jeff tells the story that he told at the start of this podcast. And it's just so powerful. And I think it can really open a lot of minds and eyes to what's happening in rural America, especially if you're not from rural America. But if you are, then you can dig deeper into the site to start to get some help and some resources. So what we're going to talk about today is on the address or the link or the menu, you can go to the programs, and it's the Rural Mental Health Resilience Program. I don't know if you use RMHRP or not, but Federal Crop Insurance, we like acronyms.
We should, because it's a mouthful, as you know.
And so I can drive on this page. If you just want to kind of walk us through and let us know what are we looking at here? What is this specific program for?
Yeah, well, thank you. So just going back to that video for a moment, if folks take the 6 minutes to watch it, you will see where I'm talking from today. It was actually primarily filmed at my family's dairy farm up here on Lake Erie in New York, as well as another family dairy farm on the other side of the lake from where we are, who have also benefited from the services we provide. So we made sure we got it done in September before it started snowing. So you'll see it was a beautiful fall day. We couldn't have picked the weather any better. So on our resilience program, again, as I mentioned, this is something we developed with the National Grange. And for those of you who aren't familiar with the Grange, and I know there's Granges in Montana and other rural states, of course, but the National Grange is the oldest and largest agricultural nonprofit organization in the country. And again, it's been around 170 years, and it's mainly based in rural areas. So they've been a tremendous partner and helped us develop this. And in fact, it's now being utilized in a number of Grange programs in various rural areas across the country. And that was discussed on the webinar we were on last night. On this page, it shows some of the other companies that have been part of the development of this. I like to say we're kind of the intersection of healthcare and agriculture and other rurally based businesses. So some of the logos that you see here are healthcare companies that have a great interest in providing resources for people in rural America. If you want to scroll to the next page, Mike, you can. And I'm going to put my glasses on for this. I'm going to throw vanity out the window. And so what you'll see here are a lot of the resources that are available. We have fact sheets, we have brochures, we have PowerPoint presentations, we have press releases. In a way, if you will, it's a meeting in a box. And I don't know if you click on any of these, Mike, if it will open up or not to show some of the beautiful materials that by virtue of the fact that you're projecting this, it may not, but yeah, there we go. So this is just an example of one of the overview of the program. And it's got a QR code on here, especially for younger people that like QR codes, where it will take you to that program. But what we've tried to do is put everything we could imagine in this program so that community groups, regardless what the community group is, regardless where they're located, has everything at their fingertips. All of these materials on this site are free. They're all downloadable. You can print them off and hand them out. You can post them up in the local VFW hall, the local diner. Um, but what we found is we, started doing our work and research on this program is all too often programs sprung up in local towns born out of a tragedy, like the tragedy I told you about what happened in my family. And somebody in a rural community somewhere, just like my mother said, we need to do something about this. But, they're busy people, they're farming or they're doing other things that are very labor intensive, and they don't have the time or the resources to be developing materials that they can utilize at their local meetings. So we took that piece of the equation out from their needs and tried to put everything in this toolkit that is self sufficient so that whenever they decide that they want to tackle this at their local Chamber of Commerce meeting or Lions Club or whatever, that they've got the materials and the resources that they need. And, many times I will talk from a PowerPoint presentation like I did, Mike, when we met up in Montana. I've got that presentation here on the site for people to use. So if you're comfortable using some slides and would prefer to do that as opposed to just talking without some AV support, that's there for you. So regardless what approach you want to take or what your comfort level is, this is a program that you can just take and run with. We're in the process now of adding to it, and that's one of the reasons we're updating our website already after 4 years. But we've also got a new version of this that I'd like to just touch upon, if I may, which is going to be geared towards young people in rural America. And I mentioned the staggering statistic that now the CDC has released about the prevalence of suicide amongst young people. We're doing a pilot program currently in 2 states, here in New York, where I am, and in the state of Pennsylvania, because they were already doing quite a bit of work in that regard through the National Grange. And so we pulled them into the pilot program. As soon as the pilot is complete, and we're getting to that point now, we are going to roll this out nationally. And I touched on this up in Great Falls when I was up there, and there was great interest about utilizing this with the 4-H and FFA and a number of the other rural youth groups that already exist. But we have determined that young people are much more likely to talk to other young people than they are their parents, than they are their school counselors, than they are their 4-H leader, especially about something like mental health. So this is a peer-to-peer program where we were developing materials that can be helpful for young people. So when they see one of their classmates struggling or one of their fellow football players or somebody that's in their FFA group that doesn't seem right and they find out that they're struggling, that they can be the ears and eyes of the community, and not to make them an expert, because, we leave that up to people like Dr. Arzubi and people that are trained in mental health. But we want lay people, whether they're adults or young people, to at least know enough to ask the right kind of questions and know where to go and recommend people seek the help that they need. So that's what this Rural Resilience Program is all about. As I said many times, we call it a toolbox or a meeting in a box, but it's designed to be used, and it's already been downloaded by, I've lost track of how many times, but it's being utilized every single day, I would dare to guess. And that's why we want to keep it fresh, and we're going to keep adding to it. So in a nutshell, that's just one of the many programs. Again, on our website, as Mike said, there's a lot of other resources. We actually have so many resources that we determined the navigation was getting a little fuzzy. People weren't quite sure where to go. So it's an embarrassment of riches, if you will. It's a problem that many organizations wish they had, but we decided that if we're trying to make this easy, especially for somebody who's struggling with a mental illness, that they can't be, digging around on a website to find what they need. We need to make it easy for them. So I would say in the next couple months, we're moving forward pretty quickly. We'll have the new website up. But in the meantime, there's a lot of great material here that I hope people will go to ruralminds.org, sign up for our free newsletter we send out periodically. We're very active in social media. We're on pretty much every social media platform. So we would ask people to follow us on social media as well.
Yeah, and he's not exaggerating when he says there's a lot of resources on their website, and just this web page alone that we're looking at on the resilience page is just a whole wealth of information, like he said, from just getting started on conversation starters to wallet holders to posters to presentations and just anything you could ever ask for or want a place to get started is just fantastic. And we'll post links to the website, all of their social media platforms, and other pertinent links and information. We'll put that in the comments or the description of the video so that everybody can have access to those. But you definitely want to check out ruralminds.org. Even in its current state, I know they're updating, but even in its current state, it's a wonderful resource for everyone out there. And when I spoke with Dr. Arzubi, one of the things he mentioned too that kind of rings through with Jeff and what he's been talking about is you don't have to wait for a crisis to start looking into how to get help on it or fix it. I mean, you certainly can if you reach that point. There's dial 988. If it's a present urgent emergency, there's always 911. But there's 988 if you're thinking about it and you need to speak with someone. You can text 741-741. And again, you don't have to be in crisis to reach out. You can go to ruralminds.org where there's just a ton of resources. And especially if you're somebody that works in agriculture and you're just looking for some help or some guidance on how to have that conversation, because maybe you notice when you go out to visit the farm to go over their crop insurance renewal that, yeah, there's a little more weeds on the road and maybe some of the bins aren't painted. Things that I never thought about until Jeff just mentioned it, that maybe then you might need some tools in your tool chest to start a conversation. And great resources here. And it's just incredible to see the work you're doing and why you're doing it. And I think your nephew would be so proud of all the work that you and your family and everybody involved is doing, because it's meaningful and it matters.
Well, thank you very much.
I can't thank you enough, Jeff. Are there any final thoughts you have or anything you wanted to add before we sign off here?
The only thing I would add is that there is hope and there is help. And I realize some of the statistics I share can be scary. They can be very discouraging. And, I don't do that for shock appeal. I do it to try to set the context and lay the groundwork for what we're going to be talking about. But there are a lot of glimmers of hope out there. There is, even in rural areas, ample help, but it starts with you, or it starts with a loved one who will help you to reach out and look for what that help is. I'm glad you mentioned 988. That's a tremendous resource, not only during a time of crisis that someone may feel, but that service, by either calling or texting 988, will also help you find ongoing resources after the crisis has passed in your local area. Even though it's confidential and it's free, they can tell from your cell phone what part of the country you're in. So if you're calling in from Great Falls, Montana, they're going to find you help in Great Falls, Montana. So it's a service that's been in existence 3 years now. Rural Minds was actually very instrumental soon after we launched in representing the agricultural community when they were putting this together before it was launched. So we're very proud of it, and quite honestly, speaking transparently, I've utilized it myself. I have used it because I thought if I'm going to be advocating for it, I need to be able to talk from the heart about it. Uh, so just please reach out to, anybody that cares, and that's a lot of people in your community, and reach out to us. You can reach us by either email or we've got our phone number, but all of our contact information is at ruralminds.org. So thank you, Mike, for the opportunity. I've enjoyed our conversation and appreciate this ability to speak to your listeners.
Oh, yes. Thank you so much, Jeff. Very much appreciated. From my family to yours, thank you for tuning in. If you found this helpful, please subscribe and share with a neighbor. Visit www.cropinsurancepodcast.com for more episodes, articles, and tools. For full policy details, always check the crop insurance provisions or speak with your local crop insurance agent. This institution is an equal opportunity provider and employer.